University of Central Arkansas, and I am going to be performing a head and neck exam today on my patient here. And I'm also going to be assessing the cranial nerves associated with this exam. So I'm going to go ahead and start. Looking at the head, it's normal cephalic. His eyebrows are symmetrical with his face bilaterally. And then also looking at the skin, making sure there's no lesions, no masses, no scarring. And then moving on to the skull, I'm going to go ahead and palpate and also just examining the hair. It's evenly distributed, and he does have a slight receding. There's no depressions, no masses, and a normal occiput filling of it. Also, when I'm doing the facial exam, I'm going to test palpate his sinuses. So I'm going to go ahead and palpate your sinuses, and when I do, I want you to let me know if they're tender, okay? So this is his frontal and maxillary. No tenderness. All right, also filling up the TMJ. Go ahead and open, close. I'm going to assess the cranial nerve 7 at this point, which is his facial. Go ahead and raise your eyebrows, smile, frown, and puff your cheeks. So cranial nerve 7 is intact. Now I'm going to assess cranial nerve 5, trigeminal, and it tests the jaw muscle, okay? And there is 2 parts to this. There's motor and sensory. So I'm going to do the motor first. And what I want you to do is go ahead and clench your teeth and then move your jaw side to side. Okay, so motor's intact. Moving on to sensory. So I want you to let me know when you feel something soft and then something sharp, okay? So,
soft.
Okay, and then
Sharp.
Okay, so cranial nerve 5 is intact as well. Also going to feel his temporal pulse. All right, so doing good. So next, I'm going to go ahead and look at the ears. Cranial nerve 8 is associated with the ears. It's the auditory. And first, before I do anything, I'm just looking and examining the external ear, looking for any drainage, any visible masses, or anything that's out of normal, redness, anything that would indicate any kind of infection. I'm going to go ahead and look at the back of the mastoid bone and making sure there's no mastoiditis. And he has no mastoiditis. And then I'm going to go ahead and do the tug test, which we pull on the pinna or the auricle. And this just makes sure if there was a little bit of, did that feel okay? Okay, and that lets us know if maybe there's an indication of infection, if it's tender. And then you can also bend the ear. And when you're doing this, you can also palpate and make sure there is no masses as well. So to test this, we would use an otoscope, and you would use the largest speculum that you could that would fit comfortably in the patient's ear. I don't have an otoscope, so I'm just going to show how this is conducted. We would pull up and back for an adult patient, and we would pull down and back for a child. And so with my right hand, I'm going to pull up and back. I would take my otoscope and I would brace against his chin. And this is especially important when dealing with children because they're very squirmy. I know because I would. And that straightens out the canal. So we're looking at the canal, and we're going to be looking at the tympanic membrane. And that tympanic membrane should be a pearly white color. If it's red or bulged, that means there's infection. Also, you can look at the bony prominences of the malleus as well and make sure that everything is intact there. So testing the cranial nerve now, there's different tests you can do. First, I'm going to do the whisper test, and you use a 2-syllable word and you whisper it, okay? So what I want you to do is occlude one side of your ear, and I'm going to whisper a word, and I want you to tell me what it is, okay? Princess.
Princess.
All right, and then the next one, occlude. Purple.
Purple.
Okay, and that is intact. You can also just do this grossly during your exam. If the patient's able to hear you, you can do it that way as well. The next 2 assessments are done with a tuning fork, which I do not have, so I'm just going to talk my way through them. So first we're going to do Weber, and this test is for lateralization. And what you would do is strike your tuning fork, place it on top of the forehead, and you would ask him if he's able to hear or feel the vibrations in one or both ears. He should be able to hear both ears work for the Reiner test is going to test air conduction. Air conduction should be greater than bone conduction. So we would strike the tuning fork, we would place it on the mastoid bone back here, then in front of the inner ear, and we would be asking him when he's able to hear it. And like I said, the air conduction should be greater than the bone conduction. So cranial nerve 8 is intact. So moving on, we're gonna go ahead and go next to the eyes. So the eyes are associated with cranial nerves 2, 3, 4, and 6. And I'm going to tell you which ones I'm testing as we go about. But first, I'm just gonna look at the eyes. So first I'm looking at the sclera. The sclera is china white, that's good. It should never have any jaundice. Then I'm gonna look at the conjunctiva, and that should be a pink, and it is. Looking at the lacrimal apparatus, just assessing, feeling, it shouldn't be dry, should be moist. Shouldn't be any excessive tearing though. And next, I'm gonna look obliquely into looking at his lens and looking to see if there's any foreign bodies. Gonna come around, sorry. And next, I'm going to go ahead and take a look at his pupils and check, for the dilation. And we're gonna be assessing the cranial nerve 2 and 3 at this point. Cranial nerve 2 is optic, cranial nerve 3 is ocular motor. And I'm gonna go ahead and test that. So what we're gonna do is I'm gonna have you open your eyes and I'm gonna shine this light into him. So when I shine the light into his pupil, it should constrict, but also the other eye should constrict as well. Okay, so looking there, and so the left eye did constrict. Now I'm gonna look at the right eye, and it constricts as well. So moving on to this side, looking at the right eye, and looking at the left eye as well. Open, please. Okay, so both of them direct and consensual. So next, and they were also, the pupils were equal and reactive to light. Equally round, reactive to light, sorry. Next, I'm gonna go ahead and test for the 6 cardinal views of gaze, and we use the cranial nerves 3, 4, trochlear, and 6 abducens with this. And what I'm gonna do, sir, is I'm gonna put my finger right here, and I want you to follow my finger, okay? So we're gonna go move, up, down, back midline, over, up, down, and then back midline. And now I'm gonna text, I don't know why I keep saying text, check convergence. Okay, so going in, we're going to about 5 to 15 centimeters. And when I do this, he should converge and his pupils should dilate, which they do. And then the 6 cardinal views of gaze were intact. So cranial nerves 3, 4, and 6, which control the muscle movements of the eye, are intact. You could also, if the convergence didn't make his pupils dilate, what you could do is do a near test. So he would look, okay, I want you to look at my finger, and then you would look away at something far away, and that should check for that as well. Okay, so now I'm gonna check, do confrontation testing, and this checks for his peripheral vision. So I'm gonna have to get in close, and first I want you to tell me when you can see my eyes. All right.
Yep.
Okay, and then I'm gonna go from superior, posterior, and check it this way.
Now.
Okay.
Now.
Okay, so peripheral vision is intact. And I think that is, oh, and then the fundoscope, using the ophthalmoscope. So I'm gonna walk this through because that'll have an ophthalmoscope. But what we're gonna do is we're gonna check for the red reflex, and the red reflex is where the light shines in his eye, and we're going to find that with our ophthalmoscope, and we're going to go in and we're going to be able to look at the optic nerve, the optic disc, and you would also be able to go nasal and be able to see like the fovea and the macula. And the way you do this is, so if I am looking at his left eye, I would want to use the ophthalmoscope on my left eye, and that just makes it more comfortable for your patient. And you go in at a 15-degree angle, and you want to make sure you're moving your ophthalmoscope with your head. And so you would just go directly in, find the red reflex, which is called red reflex because it's usually red. It can be an orange or yellow color. And just going in and checking that. And this is cranial nerve 2 that you're checking, the optic. So we would do that. And also the way you would place so if I'm looking at his left eye, the ophthalmoscope would be here and my other hand would be here on his shoulder, or I could do with my hand here with my thumb above his eyebrow. Okay? So that completes the eyes. So we're moving on now to the nose. Looking at the nose, looking externally, and then what we would use is the otoscope largest, I can't even think of the word. I would have him lean his head back, and then I would use my thumb to do that. And we would use the largest speculum that we could. And we would go in looking at the nares, and then we would look at the mucosa, and it should be a slightly pink color, and we're making sure there's no polyps. So want to do that and assess that. And then the cranial nerve associated with the nose is cranial nerve 1, olfactory. And I'm going to have you occlude one side of your nose, sir, and I'm going to have you tell me what you're smelling. So what is this?
Cinnamon.
Okay, and then go ahead and occlude again.
Cinnamon.
All right, he has his smell back from COVID. But when you're doing this test, it's best if you could use 2 different scents. That way you can assess better, because if he gets it right on one side, he can get it right on the other. Also, when you are looking in the nose with your light, be sure you're careful, because the nose is very vascular, so you don't want to cause any bleeding. All right, moving on, we're going to go ahead and move on to the mouth. Looking at the lips, we want to make sure they're moist, pink, no hepatic lesions, no cracking, and his lips look good, pink, normal, moist. So then I'm going to have him open his mouth, looking at his dentition. Let me get my light. Good. Looking at his gums, making sure that he doesn't have any gingivitis. I'm going to go ahead and get my glove on and look around. Looking at the papillae on the tongue, and then looking under the tongue, it's smooth, it's pink, no lesions, no masses, no gingivitis. And then I'm going to test the cranial nerves that are associated with this. And these nerves are 9 and 10. 9 is glossopharyngeal, 10 is vagus. And these tests for the swallowing reflex, go ahead and swallow. And I'm going to have you say, ah. Looking at the uvula, it's midline. And then also looking at his tonsils, let me see. 1 plus pharynx, there's no exudate. And his hard palate is a white color. Okay. And then I also test cranial nerve 12, which is his hypoglossal. Stick your tongue out. Tongue's midline, go ahead and stick it back in. So if it deviated, that would show an injury. Stick it in your cheek. Okay, other side. All right, so cranial nerve 9, 10, 12 intact. Moving on, we're gonna look at the ears. So the way we do this is first we look external, looking for any redness. We can do the tug test, which we tug on the pinna or auricle. And if it was tender, is it tender? You can also bend it, just making sure there's no masses. And tenderness could indicate infection. If it was red, it would indicate infection. Looking at the mastoid bone, no mastoiditis. And then also gonna go ahead and use my otoscope, which I don't have. So I would pull up and back to look for an adult, down and back for a child. And this straightens the canal out so you can see what you're looking for, okay? I'm looking down the canal. So you would use the largest speculum that would fit in comfortably into the ear. And you'd be looking at the tympanic membrane, which should be a pearly white. If there's any redness or bulging, then that's a sign of infection. And you also look at the bony prominences of the malleus, okay? Cranial nerve 8 is associated with the ears. It's your auditory. And the way we do this is we would close one ear off. And I'm going to whisper a word.
Purple.
All right. The next one.
Princess.
Okay. And cranial nerve 8 is intact with that method. And then you could use the tuning fork, and you would strike the tuning fork, place it on the forehead. This is for Weber, and you're testing for lateralization. So you would ask him if he can hear it or feel the vibration. It should be equal in both ears, okay? And that means there's no hearing loss. And then for the Reiner, you're checking for air conduction is greater than bone conduction. You would strike the tuning fork, place it on the mastoid bone, then in front of the ear, okay? And it should always be air conduction is greater than bone conduction. And his cranial nerve 8 is intact. So moving on to the neck, we're looking at the trachea, making sure it's midline. It is. I'm gonna go ahead and displace it to one side. And looking, making sure there's a twisting of the neck, anything, no masses, no lesion. We could also, I'm not assessing the thyroid right at the second, but you would also notice if there was a goiter at this point, which he has no goiter. I'm going to test cranial nerve 11 now, which is the spinal accessory. What I'm going to do is I just add a little resistance to his shoulders and have him shrug up. Okay, and so cranial nerve number 11 is intact. So next I'm doing the lymph nodes. So we're going to go ahead and do preauricular. You do these with your 2 or 3 fingertips, and you do a circular motion. They should be palpable and should be movable and non-tender. So you let me know if they're tender, okay? So preauricular, postauricular, tonsillar, submandibular, submental, excuse me. And then we're going to go back and do occipital. And then for deep cervical, they're really hard to feel, but if you have him turn and fill in this, I still can't feel, but that's how you could have it, do it, but I don't feel them. And then we're gonna do superior clavicle and then infraclavicular. And then I'm also going to do posterior cervical as well. So those are the lymph nodes, no tenderness, right?
No tenderness.
Okay, so now I'm going to check the thyroid, and I'm going to do this posteriorly. So the way you would do this is I would either stand up back behind him or sit down. I'm going to do it sitting down. And you come up behind him, and what we do is we look for the cricoid cartilage, excuse me, and we're going to find that. And then I'm going to have him swallow, and we're going to feel the isthmus rise up in between our fingers. And just kind of palpate and make sure, and his thyroid isn't swollen. So it's felt good. All right, and so this completes the head and neck exam and the cranial nerves associated with the exam.